Welcome to RPNAO's Self-Care Series. This is Module 1 of Mental Well-Being in the Self-Care Series. This module is focused on stress and coping. Our agenda for this session will include a discussion on understanding what stress is, the impact of stress, and how to assess stress. We will then review coping strategies and the importance of recognizing harmful coping versus adopting helpful coping mechanisms. Stress. Stress can be defined as the psychological or physical state that results when an interaction between a situation and an individual depletes the resources available for the demands of the situation. For example, physical stress can be due to disease. Psychological stress can be stress due to fear. Stress can occur when an individual does not have enough resources to manage the demands of a situation. An individual is in a situation that is unpredictable, uncontrollable, or has conflict. There are specific timeline deadlines, or periods of stress can occur in some individuals more than others, and in some situations more than others. Acute. When stress is acute, we may notice changes in one's behavior, feelings, thinking, and physical changes. Changes noted in behavior can include being withdrawn, aggressive, and feeling unmotivated. Changes noted in one's feelings can include feeling anxious, depression, being irritable, or increased fatigue. Changes noticed in one's thinking ability can include having trouble concentrating and solving problems. Changes noted in one's physical capabilities are developing palpitations, nausea, and having headaches. Chronic stress occurs when stress persists. It can affect your digestive system. One may experience abdominal discomfort as the body begins to slow down the emptying process of the stomach. Diarrhea can also occur when there is increased colon activity. Obesity. Some individuals may use eating as a coping mechanism to respond to stress with an increase in food consumption, which can in turn lead to weight gain. The immune system. When stressed, the immune system begins to weaken, which can result in individuals becoming more prone to infections. The nervous system. Individuals who are stressed may also be suffering from anxiety and depression in relation to the perceived or actual threat to the body. This can be exhibited in the ability to sleep and or decreased interest in physical activity. A decreased interest in physical activity can also lead to obesity. Cardiovascular system. When stressed, the body begins changes that can occur in the cardiovascular system in several ways. There may be an increase in blood pressure and heart rate. In addition, cholesterol, triglycerides, and blood sugar can also increase. When this occurs, it places one at risk for heart disease, atherosclerosis, and stroke. Good stress, also known as eustress, can occur during short time periods involving slightly challenging situations. Good stress can also be a motivational force in one's life, as it can attempt to bring achievement to goals and accomplishments, such as that it can motivate an individual to perform well in a job interview. This can be seen as positive in one's life and exciting. Once stress furthers itself negatively, that's when it can begin to become negative in excessive amounts. Job stress can be defined as the harmful physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or the needs of the worker. Factors that contribute to a nurse's job stress can include increased workloads, management who is unsupportive, issues with human resources, process of patient handover, shift work, and relatives of patients. Stress has been shown to affect both nurse educators and students adversely in both the education and work life of each, respectively. With ineffective coping, stress has been shown to cause nursing students to leave their nursing program. All students have similar forms of stress, which include a heavy academic workload, exam stress, and nursing students are also faced with additional stressors that are unique to them. Nursing students' practicum courses have been shown to be one of the leading stressors in a nursing student's life. It involves a reality shock related to the workload demands of practice. Clinical staff with negative attitudes experience the impact of death and the anxiety that comes with worrying about making an error in their clinical placement. Nursing educators are also affected by increased levels of stress in the workplace. This involves new nursing educators who are lacking readiness with faculty work expectations, in addition to their teaching role, and including the stressors of being a researcher or mentor for the students. There's pressure for some educators to maintain competence in both his or her clinical areas, in addition to their educational role. In addition, educator roles can be quite complex, as technology is constantly changing with new advances. There are also additional demands by students, placing the focus on the educator to provide what is required for their success. Mindyourmind has provided a tool that will not stop you from being stressed. However, it could assist you in relieving yourself from feeling rushed or from losing focus. First, you begin by developing a list of items that are presently causing you stress, and take them from your mind to writing them down. You do not need to order them in a specific order, and you can continue to add to the list as you become more aware of added things requiring attention. Secondly, you then add a note to each item you've added. Make a note whether it is something you can possibly cancel or let go of. Can it be postponed? Is it requiring a higher priority on your list? In addition, note whether other individuals may be involved in resolving the item on the list. You then begin to eliminate or delegate some of the items you have made notes on. Lastly, begin to resolve and deal with the items on the list that you have not chosen to eliminate. We will now examine how effective coping mechanisms can benefit both the nursing student and nurses in all practice settings. What is coping? Coping is something that people do so that one can avoid harm from life strains. In order to cope successfully and effectively with a given situation, one must adjust one's own coping techniques for that situation to be able to have a positive outcome. When one is able to cope with stress effectively, it can assist individuals in reducing potential negative consequences in one's own psychological wellness. In a study done in 2016, it was found that when nurses had a high amount of stress, in addition to poor coping abilities, they had more days of feeling worried, not getting enough sleep, feeling depressed, and suffering from pain. That being said, coping can assist individuals in reducing negative consequences. Lastly, studies have shown that there is a relationship between one having psychosocial stress and its impact on diseases. It can be related to the nature of the stress, the number of stressors in one's life, the persistence in how often it occurs, the psychosocial resources that are available to oneself, and how one has learned patterns of coping mechanisms. 4 categories of harmful coping strategies are shown here. They include avoidance, distractions, chemicals, and violence. Harmful strategies can include negatively criticizing oneself, hitting another individual, throwing items or yelling in an aggressive or violent way, eating too little amount of food required or too much, or using recreational drugs, or not using prescription medications in their intended way, and finally avoiding one's families or friends. Helpful ways of coping can assist an individual to solve situations. Not all helpful ways of coping listed here will work for each individual. It's important to try a variety to determine which one may work best for your specific needs. One must be aware that some coping mechanisms can lead to new stress, and this depends on the individual. For example, if you decide to go on a holiday to relax, the holiday could cause greater stress. Helpful ways to cope with stress can include listening to music, spending time or playing with a pet, taking part in social activities which can include shopping, dining, or going to watch a movie, going outdoors or taking part in activities, exercising or gardening, meditating and practicing deep breathing techniques, and finally seeing a counselor if stress persists and becomes unmanageable. Our PNAO also offers a variety of resources on our website to assist you in your self-care. This includes a self-care inventory, a goal-setting worksheet, a critical reflection worksheet, and a self-care wellness plan.